Performing adult cardiopulmonary resuscitation using automated external defibrillator. The presentation will discuss an issue that will cause a person to need CPR and signs and symptoms to this condition and the proper steps to CPR. What is cardiac arrest? Dwight and O'Neill, authors of Fundamental Concepts and Skills for Nursing, defines cardiac arrest as a sudden, unexpected loss of heart function, breathing, and consciousness. Now, signs and symptoms of cardiac arrest include unresponsiveness, no pulse, shallow or gasping for breaths, chest pain, difficulty breathing, and palpitations. We next need to perform high quality chest compressions, initiating compressions immediately after recognition of cardiac arrest. The American Heart Association states performing high quality compressions on an unresponsive victim is critical to survival for the victim. High quality compressions include correct hand placement, compression rate, compression depth and recoil, minimize interruptions in compressions. Correct hand placements include lower half of the sternum is where we need to place our hands, two-handed, second hand on top of the first, or grasping the wrist of the first hand like shown in our slideshow. Compression rate of 100 to 120 per minute. Delivers 30 compressions in 15 to 18 seconds, no longer than 18 seconds. Compression depth and recoil at least 2 inches, 5 centimeters, and avoid compressing more than 2.4 inches, 6 centimeters. Use of a commercial feedback device or high fidelity manking is highly recommended. Complete chest recoil after each compression, minimizing interruptions in compressions. Delivers 2 breaths, so less than 10 seconds elapse between last compression of one cycle and first compression of the next cycle. Compressions resume immediately after shock or no shock indicated. The next step in our CPR process is to provide 2 breaths by using a barrier method. To do this, first we want to first make sure we're opening the airway adequate by using a head tilt chin lift maneuver or jaw thrust, delivering each breath over a period of 1 second, making sure that we deliver breaths that the victim's chest rise. To ensure this, we are making sure that we deliver breaths adequately. We also need to avoid excessive ventilation. Dwight and Kamanji states excessive ventilation can cause a victim to vomit if air is delivered into the victim's stomach instead of the victim's chest. He or she will vomit. Next, we then need to resume chest compressions in less than 10 seconds. And we also need to make sure that we have proper use of our AED. Perform some steps for compressions and breaths for cycles, and then our AED use. We need to make sure first that we power on our AED. So you turn on the AED by pushing the button or lifting the lid as soon as it arrives, correctly attaching our pads. So you see we have 1 pad in the right upper chest, and then we have our next pad in the lower portion of the left sternum. Um, so correctly attaching the pads, placing proper size adult pads for victim's age in correct location. So you wouldn't use an adult pad on a child. Um, it will give the instructions to clear for analyzing. So you clear the rescuers for victims for AED to analyze the rhythm, and it should walk you through it, and it'll tell you to push to analyze the button if required by the device. Communicates clearly to all other rescuers to stop touching the victim, because we want to make sure that we are not shocking no one but the victim. So to clear you for safety, deliver to shock. Communicates clearly to all other rescuers to stop touching the victim, to deliver that shock to the victim. So it delivers the shock, and then you will automatically resume the chest compressions immediately after the shock is delivered. We do not want to turn the AED off during CPR, and we're going to resume our high quality chest compressions, or resume immediately after shock is delivered. And that would be what we need to do to administer the proper use of CPR and AED to an adult victim.